like to tell you what the format of the program is today. First, we will just do short relaxation or meditation, whatever you call, and we will start that, and just for a few seconds. After that, I will give you some theoretical background and things about anxiety and how to deal with the anxiety during this COVID. After 15 minutes or so, Dr. Nipa Seth will be talking. After she's done, we will have questions and answers, and then you all get to interact and talk to us, and then we'll see how you can handle this difficult time. To begin with, you all know one or the other forms of relaxation. It does not matter how you do the relaxation. It's like saying that I want to go to Chicago. It does not matter whether you take the bus or the train or go by the airplane if you can. So when you reach there, it's still Chicago. So for that matter, everybody has their own style of doing certain rituals of relaxation. Let us start with abdominal breathing. So you all put your hand on your belly button on the right hand and the left on your chest. Just close your eyes and start breathing. And when you breathe in, make your stomach, your right hand go up. When you breathe out, your right arm hand goes down. Keep doing that for a few seconds. Just relax your shoulder. Let go of all the tensions in your shoulder. Keep breathing. Just bring your attention to your belly button. Calm and quiet and breathe. Now let us do just few minutes of body scanning. Pay attention to your toes, your foot, your calf muscles, the knee, and your hip, and your stomach. Keep breathing and see when you breathe in, make your right hand go up. Breathe out, it should come down. And your chest, your neck, your chin and jaws, forehead, and your head. Now, again, keep breathing, and then tense your toes tight, 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 and your foot, again, tense and let go. Calf muscles, tense and let go. Your hip, tense, 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 let go. Your stomach, tense very hard and let go. And your chest, tense and let go. Your neck, very tight and let go. Your face, tense, tense, tense and let go. Keep breathing. Just do the breathing. Key in here is when you breathe in, make the stomach go up. Breathe out, make the stomach go down. Just do that for a few seconds. When you're ready, open your eyes. So this is one way of quick relaxation. Now let's talk about, this is me, and I have been doing this for last 25-30 years. So we have 3 clinics, and we do lot of behavioral modifications, and then write books and teaching is one of my hobbies. So let's talk about what is new normal. Normal itself is a misnomer because we don't know what the normal is. We all have stress and anxiety that is taken for granted. But what is new in this era of COVID-19 is a new stress and anxiety. And the reason is, the new reason is, number one, uncertainty. Uncertainty of what? Uncertainty of existential, which is thinking whether I'm going to die or my loved ones are going to die, or the disease like, am I going to get the disease or my loved ones are going to get the disease? Or the job, am I going to keep the job or going to lose the job? And the money in terms of whatever the saved money, if you have lost it in your stocks and bonds, am I going to get it or not? And the power, the job, am I going to keep? So this is very uncertain. And and also the second component is loneliness. Loneliness can be isolation. What is isolation? Isolation is being on your own, forcefully being on your own, like we all doing now, staying at home, not going anywhere. But the loneliness, on the other hand, being on your own, but you do not want to be. So the loneliness is a vicious cycle. When you're lonely and you're sad, and the sadness leads to withdrawal, less energy, and spend time ruminating, and then your attention is drawn somewhere else, and that itself leads to, again, loneliness. So that is the vicious cycle. So if that is the case, let's talk about stress. Stress can be defined as mind to muscle or mind to muscle reactivity. Our physiology, or we have two different systems in our the brain. It is sympathetic and parasympathetic system. What is sympathetic? Sympathetic is flight or fight, or parasympathetic is rest and digest. When you are stressed, your sympathetic system goes up and your parasympathetic, which is rest and digest, goes down. Key here is to balance this. So when you are aroused or flight, the sympathetic, what happens? Rapid breathing, tense muscle, racing heart, sweaty extremity, butterfly in your stomach, restless mind. Keep in mind, all of these things could be different for different people also. Not everybody has the exact same thing in of all of these. You may just have rapid breathing, or we just have sweaty extremities. That we call it as physiological signal. And then on the other hand, when the parasympathetic system goes down, your immune system goes down, your thyroid function is not functioning properly. And then what happens to the stress hormones? Your pituitary is releasing the stress hormone, and your adrenal gland releases the ACTH, and then it is the cortisol, which is a stress hormone, is increased. So it becomes again the vicious cycle. There's stress hormone, and then you get into a more and more stressful situation. So let's talk about what is learned helplessness and learned optimism. When you are stressed and when you start thinking, when you go into learned helplessness because we call it 3 Ps: personalization, permanence, and pervasiveness. When I say personalization, then you say, oh, it's everything about me, versus optimism is not me. Permanence, oh, it is never going to change. And whatever this COVID-19 has come, I don't think it is going to change at all. So that's a pessimism. On the other hand, you can start thinking it may change. We don't know when, but it might change. And pervasiveness, it's all about me, and it's only me. As you all know, it's not just one person, it's the whole world. So it is not, everything is not just you. So if that is the case, start thinking of what I can control versus what I cannot control. You can keep saying I can control my attitude, how I follow CDC recommendations, or if I want to, if I really want to, I can turn off all the negative news, and I can do finding things to do, and I can be kind to others. On the other hand, I cannot control is how long this will last. Nobody knows. How others will react, it is not in your control. How others will follow the rules, so on. So this is, you think of what you can control versus you cannot control to be in and also it has 3 parts: it's challenge, control, and the commitment. So what is the solution? The solution of new model of self-care. That's goal, tool, and rituals. What would be the rules? That is, reduce overreactivity of mind and muscle. In a way, the stress is, it is the overreactivity of your mind from your mind. So the tool is what we call it 3 T's: time, touch, and talk. In this COVID time, we cannot touch, but we can touch through our WhatsApp, cell phone, phone calls, and things like that. And the time, you set up a particular time to talk to certain people and your own kith and kin, your own family member, and talk. What do you talk? Talk about your feelings, not about stock market, not about, you know, what has happened to, you know, gossip. It is talk about what is important is the feelings. And the ritual is, in this day and age of COVID, there is no routine to begin with. Even otherwise, your routine has to be deliberately made into a ritual. So I have listed some 12 self-care tools. Because this is a 2-part series, and then the next week we're going to elaborate on this one and give you a little more in depth into this, the tools. But there are 2 kinds. You can see in that toolbox you have 2 kinds: mind to muscle tools and muscle to mind tools. The mind to muscle tools is, one of them is forgiveness and uprooting anger. We will go into the details next week. And gratitude, that's a gratitude journal. And worry control and activity engagement. Mindfulness and meditation, we just touched upon. And self-compassion, which is very important. And then you had to be compassionate to yourself. And VIA, or the personal strength discovery, that is just to find out what is your strength and what is your weakness. We all have our strengths. For example, some of us write poetry, some of us are very good in singing or art and things, and find that what your strength is, which you have been always wanted to do, but you cannot do it, and this is the time to do it. And social sharing with your friends and family and the relatives. And the muscle to mind tools are mindful diaphragmatic breathing, we just started, and the body scan. And then anxiety desensitization, we will go over next week. Rest and that is sleep and activity balance, which is very, very important, especially as when we get older. When to sleep, how much to sleep, and how well we sleep is very important. And then mindful eating, like you all heard last week. And then I will give you some things for you guys to practice. And then next week we will go over and see what all things you have done. We will share it. So what do you do when you wake up? What do you do mid-morning, lunch, afternoon, evening, and bedtime? For example, you wake up, you can do gratitude journal, meditation, yoga, breakfast in sunlight. I say breakfast in sunlight because it's extremely important. We all have to get enough of sun exposure in this era of COVID-19. The best way to get the sunlight is in the morning, which has the highest vitamin D, and also it helps you your depression as well as your anxiety. And then mid-morning nature walk or gardening if you have a chance to do gardening. And after lunch siesta, as you get older, taking rest for siesta in the afternoon is important, but how long you do it, not too long so that you can sleep well in the nighttime also. 10 to 15 minutes of siesta is recommended. And again, we talked about time, touch, and talk. And then that is in the evening, and the bedtime, music, or self-compassion, and the reading. These are some of the tools that we have, we will discuss further. So at this time, and I think my time is up for the 15 minutes, and we'll come back to the question and answer pretty soon after Dr. Nipa Saith is done talking. So at this point, I will stop sharing and I will let Nipa talk.
Thank you, Kusumji. That was awesome.
Thank you.
And now, Dr. Nipa, your turn. Go ahead.
Thank you, Dr. Bhatt. That was extremely useful. I think I should use some of these practices in my dental practice. A lot of the patients who come in are so stressed out usually. So this would be pretty useful for them. Just give me a minute to share the screen. Okay. So today, last time in my talk, I had mentioned about replacing teeth, and I'm sorry, I talked about tooth extraction and how, as a dentist, I do my best to discourage people from extracting their natural teeth as much as possible. However, there are situations where we absolutely need to extract a tooth. In a situation like that, what do we do next? Is it necessary to replace that tooth? Why and how is something I would like to cover today. So let's go with the whys first. Can everyone see this slide?
Yes, yes.
Okay, thank you. So when we lose a tooth, let's say, for example, in this case, this is a lower molar, this person has lost. Most of the time, people think that, it's not a big deal, my chewing efficiency hasn't gone down, and they're absolutely right. losing one tooth, maybe even two, is really not that big a deal as far as your chewing capacity is concerned. However, what it ends up doing is what I'm showing you here. It's called a domino effect, where let's say when this tooth is firstly immediately lost, these two teeth are standing upright. Where after a few months, these two teeth tend to start slanting towards the open space. When that happens, this upper tooth will then migrate downwards because it needs something to meet with. It cannot be in an empty space. And you can see now that the negative effect this is having on the entire teeth structure. These black areas you see are areas where food would start getting caught because now there are gaps and such. And that's where cavities would start rampantly. So what the danger of not replacing a tooth is not so much the chewing capacity, but more so the damage that you have on the entire dentition. If that ends up being more than one tooth, for example, here, there are two teeth on the top and two on the bottom, the damage is far worse, where now you have these two teeth coming down all the way to the gums. These are going all the way up to the gums. These front teeth start to flare out. And there is even much more damage on this entire dentition. So this is why no matter how many teeth are lost, except for wisdom teeth, unless the wisdom tooth was replacing one of your important molars, you don't need to replace a wisdom tooth. But other than that, every tooth that has been extracted, you should try and replace that as soon as possible after the extraction and after the healing has occurred. Now, let's talk of the different methods of replacing a missing tooth. Here are some of the removable kinds of dentures that we have. So there are two ways of replacing missing teeth. One is the removable kind of replacement, and another is the fixed kind of replacement, one that is fixed into the mouth. In the removable replacement, we have different varieties, but these two are the most popular. This is what it's called a metal valplast combination, which is the inside would have this cast metal framework. This metal is actually cast. It's wax, and then they cast it in the furnace, etc. It's custom made, of course. Whereas this is it's like a flexible acrylic. And so this one is a little more aesthetic. I prefer a combination if my patient prefers a denture over a fixed option, or for some reason we can't do a fixed option. My personal preference always is to give a combination of these two, which is doing the metal on the inside, but do these clasps on the outside so that, it's kind of blends well with the gums, and it's not, it's aesthetically a little more pleasing. The problem, so the pros of a partial denture obviously is that you have replaced your missing tooth, so all those negative effects I talked about in the earlier slide are obviously not there anymore. The cons of a partial denture as opposed to a fixed, of a removable denture versus a fixed, is that these clasps do have a negative effect on the teeth that are supporting them over the long run. It's just simple rules of physics, because if the tooth replacing this, if the tooth here is taking all the load of, as you chew, this pressure kind of moves this denture in this direction, and along with that, the tooth also tends to move ever so slightly. And over a period of 10 years, you are going to start to lose some attachment on those teeth. Compared to not doing anything at all, of course, this is a much better option. but it does have somewhat of a negative impact on the teeth it is supporting, which is why when we do design partial dentures, we try and take as much support as possible from multiple teeth, not just one or two teeth. Let's talk of fixed options. Now, like I said, it's always preferable for someone to have a fixed option so that you don't have to bother with, putting it in and out, cleaning it all the time, worrying about whether it's going to fall out, if it's loose, etc., etc. So in your fixed option, we have two different kinds of replacements. One is what we call a dental bridge, and one is the dental implant. For example, in this case, this middle tooth is missing. In a dental bridge, we take the support. It's literally like a suspension bridge. Think of it like a suspension bridge, where you're suspending this fake tooth in the middle with support from either side. So we have to sort of do, every time we put something on a tooth, we need to kind of grind the existing tooth on both these teeth, and then the lab would fabricate something that looks and functions just like your teeth. This is then cemented in. You have to treat it like normal, where you brush around it and floss, etc. So the pros of a dental bridge are, of course, it's fixed in your mouth, so it's far easier to clean, etc. You don't have to worry about removing it. The cons are, because in this area it's connected, you can't floss very easily here. They have things like floss threaders, etc. But most people kind of tend to avoid that. It's a lot of work. So there is a chance that you might develop either bone loss or some sort of cavity in this area. But again, compared to not doing anything, or perhaps even the removable, this is a much, much better option. Let's move on to the next one, which is the dental implant. A dental implant is a standalone unit. It is a titanium screw that is placed inside the bone. And then there is this little part that sticks out, which simulates this part of the tooth. It's called the abutment. And then we put a cap or a crown on top of it. The titanium screw is placed either by an oral surgeon or an implant surgeon, or perhaps your general dentist if they are experienced enough. Once it is placed in, it takes about 3 to 4 months for the bone around it. You see the screw has these, it's like a screw, so it has these notches in it. And over about 3 to 4 months, the bone starts to form around these notches. It gets inside the notch so that it's held very tightly. We have to wait for that to happen and for this implant to be completely stable inside your bone before we go in and load it, as it's called, before we go in and sort of put the abutment and the cap so that you can start chewing on it. While that is happening, we either leave this alone, or we can put a temporary, if your dentist feels that yours is the sort of dentition where the teeth might move easily while we are waiting for these 3 to 4 months, they might suggest like a little removable temporary denture just to hold the space, just so that these don't start to move in. The advantages of a dental implant, obviously, are that you're not grinding tooth structure. It absolutely simulates a dental tooth. It's the closest to simulating a dental tooth in form and function. And it's very easily cleansable. You can easily floss between these teeth. The disadvantages usually are financial. However, nowadays there are more and more of these Chinese implants coming in, which are obviously cheaper than the regular ones. And some of them are quite good, some of them not so. So you have to kind of do your research and see which dental implant works best for you. Dental implants are not for everyone. If you're a severe diabetic and such, your your body may not be able to generate that bone that's needed. If it's an uncontrolled diabetes, it may not be very wise for us to do surgeries and such. It might actually be counterproductive, in which case we would either opt for the bridge or the denture. The point is that, like I said, no matter what, it is extremely important to replace missing teeth. Now, let's talk about teeth where you have all your teeth missing, a full denture. Now, as you age, you're losing bone every year. You lose X% of bone every year, and you will notice that your dentures are getting looser and looser. Yes, you can go in and kind of, keep adding material to that denture to make it tighter, or keep making new dentures, but at some point, there will not be sufficient bone to hold that denture. The only thing that holds a denture in place is the existing bone structure. What has now come in the market is something called an implant supported denture. So what would happen is you would have, say, 4 implants. They are placed strategically in, like, say, one in the premolar area, one in this canine area, and then again on the other side. And then they fabricate a denture that sort of just kind of sits on it. It's like stuck into it. It's a fixed kind of an option where your dentist then goes in and screws it up from the top. This is one of the best options now in the market. Again, it is not for everyone, because you do need some amount of bone structure for us to be able to put an implant. If you have almost no bone, then the implant would be too short, in which case it defies the laws of physics, and we can't put an implant in it. So yes, so these are all the various options of replacing teeth, and the pros and cons of it. And I'd strongly urge anyone who thinks that they can function without teeth to go in for a consultation with your dentist and find out what your options are for replacing teeth. I'm going to end this and take questions next.
Thank you, Nipa. So
That's nice.
So now it's all up to everybody's attending. So you had 2 wonderful guests here, and they shared their wisdom. And I was just giggling because in the morning we had a class with our seniors, and that's what we talked about. And we spent the time to figure out how to go into the daily routines and take care of your body. So any questions you have, please go ahead and
mute it.
So please go ahead and ask any questions you have to our panelists. So you can unmute yourself and ask the question, or type it here.
I have a question.
Go ahead, Shobana.
Yeah, I have a question to the doctor.
Yeah.
What about Waterpik? Does that replace flossing? Because my teeth are so close, I cannot floss. It's really difficult to floss.
So actually, if teeth are very close together, then flossing would be easier than Waterpik. Waterpik is usually recommended when there's more of a gap, so that the water can kind of flush into the open space. No, it does not. To answer your question, no, it does not replace a floss. Nothing replaces a floss. However, it does replace not doing anything.
Yeah.
So if that is your choice, flossing is harder. That is the problem. Most people actually floss incorrectly. So one of the first things I do when my patient comes in is actually teach them to floss, because and perhaps I'll cover that in one of my talks. And unless done correctly, you're basically not doing anything. So in place of that, I would say yes, Waterpik is perfectly fine, but as far as possible, maybe do both. Maybe 3 days a week do a Waterpik, and 4 days a week try flossing.
Flossing is very difficult because I have implant, I have bridge, I have crown, and they're so close. doesn't even, I cannot even floss. So it's
Yeah.
very difficult.
So if Waterpik is working, and let's say when you go for your checkups, you don't have cavities and such in between your teeth, then it's great. It's working for you. Then it's fine. Then I wouldn't change anything. However, if cavities are discovered, then I would change from Waterpik and then start maybe flossing. It's actually something called a floss threader. You have to, it's like a needle, and you have to put the floss in it and then kind of go from under.
Yeah, I have it. Yeah.
Yeah, those are usually the ones used then.
No, between my teeth, I cannot put the thread, what is that, floss, because it's so close. So that's the thing.
Yes, so in that case, Waterpik is good. Yes, it will force the food out.
Okay, thank you.
Okay, so we have a comment by our mentor here, Naren Bakshi. So Narenji, would you like to come back and share something?
So, first of all, I'm sitting in Jaipur, far away, but am able to completely enjoy just like you are in Silicon Valley. In fact, I'm so delighted that some other people like Umardeen, he's also calling in from Jaipur. Surendra Chadda, I've known him, he's my classmate, calling in from New Jersey. So wonderful. Congratulations to the organizers. I mean, we got forced into 100% online, but it has opened a new avenue. I mean, something we thought we could only do for Bay Area people, only South Bay. Now we can go worldwide. In fact, there is a request, can we start a CWC India initiative? Wonderful. So congratulations to all of you. And I even see some friends like Meena and so many people that I know are coming forward. So just wanted to thank you as a coordinator, Deshmukh ji.
Yes.
Of course, I've known Kusum Bhatt for a long time. Now, just think about Kusum and Nipa are busy doctors. And they are volunteering along with, they are also putting some of their money. So, I mean, they are self-love people. We should thank them. That's it.
Thank you.
Thank you, Narenji. So, Pushpa Agarwal, so you had a question, go ahead.
Yes, for Dr. Seth. What is the sequence it should be the better? Like, brushing, flossing, Waterpik. So which way, what do you do first? A lot of people have different ideas. So I just want to know which way is the better.
So my suggestion is, firstly, you should be brushing twice a day. So mornings, usually when people are in a rush, if possible, you can try and brush after your breakfast, so that you have now removed not only the night's plaque, but also whatever you've eaten from breakfast. If that is not a possibility, or it's something that you don't care for, then you can brush before breakfast. And I had addressed this last time as well. I absolutely recommend electric toothbrushes. So you would use your electric toothbrush. I personally do not floss in the morning. I'm too much in a rush. And flossing cannot be done when in a rush. The brushing should go on for about 2 minutes. Then you rinse your mouth and you clean your tongue with the tongue cleaner, not the toothbrush. And that's that for your morning. If in the afternoon, after you've eaten, if you have a toothbrush handy and can brush, great. If not, just rinse your mouth. It's not essential to brush at that point. At night, you do want to brush, then floss, and then clean your tongue.
And when do you use the Waterpik?
So it's either floss or Waterpik. It's one of the two. So or brush, Waterpik, clean tongue.
Okay.
So in that order, brushing usually comes first. You don't want to, you want to remove all the majority plaque with the brush, and then go into the finer one with either your your floss or your toothpick.
Yeah, because in the morning I brush 4 times a day. Before breakfast, after breakfast, after lunch, after dinner.
Oh wow, okay.
But the only thing, since I started using the water pick, my dentist said my gums, I mean, my gums are always had been good, but she said now this is much more healthier and much better.
Excellent, excellent.
And I really like it. And because if I don't do that, I feel like something is wrong. And same thing with the cleaning the tongue. It's always been like brushing, clean the tongue and the water pick.
Yes, exactly.
But
So-
I have another question. But what I have noticed, I'm not satisfied. So I just want to see if everything is clean. So I take the toothpick and I go in every teeth and there is some white plaque comes out,
That is exactly what a floss removes far better than you said it, just hit the nail on the head. That's exactly what a floss removes far better than a water pick.
Right. So what I start doing
tiny,
after,
pesky, sticky stuff.
right. So what I start doing now, because when I see that, so after the water pick, I do floss, but still I'm not satisfied. I still use the toothpick a little bit. So once in a while from somewhere it comes up, sometimes it does not.
Yeah, and I'm glad you addressed toothpick. On the topic of toothpick, I can't tell you how many dental emergencies I have in the year where the toothpick, where a splinter of the toothpick has embedded into the gum. These toothpicks are not made from the best materials, and a lot of these splinters do sort of come off and get embedded into the gum. So I'm not such a major fan of toothpicks.
No, I have that, the rubber tip.
Oh, the rubber tip. Yes, yes.
I
Yes,
use that.
that's different. Yes.
I keep in my purse also. Suppose sometimes I cannot brush after dinner, lunch.
Yeah. That's not a toothpick. The rubber tips are good. Yeah.
Rubber tip.
Yeah.
Okay. Thank you so much.
Of course, my pleasure.
So another question for Nipa. So the question is from Veena. So she wants to know how safe it is to see the dentist in this time. So I believe everybody has this question.
Yeah.
Excellent question. So right now, the CDC guidelines and the ADA, which is the American Dental Association guidelines, prevents us from practicing unless it's a dental emergency. So you should not be seeing your dentist for anything other than pain, swelling, etc., etc. And even then, the first line of defense from our end is always medication. We will try and bring down the pain and swelling with antibiotics, anti-inflammatories, something to that effect. If that doesn't work, we will refer you. There are specialists who are working. They have their N95s and the all the face shields and whatever else, who are following the CDC guidelines. The problem is not all dentists are still equipped with that. We are in the process of doing it. In fact, I'm part of a WhatsApp group which is pinging every day because now we're in the process of buying our masks and all the equipment needed, because dentistry is going to be very different for the next year or two. Unless that happens, we cannot see patients because with the aerosol, etc., we do more damage than good. So it's only these specialists who right now are following CDC guidelines that we would refer you to, and only for emergencies.
Thank you, Nipani. So I think I'll ask the same question to Kusum also. What should be people's take to see the doctors, or if they need something basic?
It's again depends on your county to county. For example, in our county, John Muir is one of the major hospitals, and they have started elective surgeries, and then they started doing antibody testing, which is available, and then in fact in the other hospital like Antioch, it is more available. So it all depends on your county to county. On the other hand, in our own clinic, and then we have started doing some procedures. For example, endocrinologists are doing the biopsies, and then we do skin tests, but wearing completely protective masks, and then we give the injections in the parking lot, and we do not have the injection given yet inside the thing. So it all depends on place to place and then the county to county. So the best thing is to listen to CDC guidelines and then follow that, because this is changing, and then every day things are changing. For example, there is a new findings now. It's called happy hypoxia, and then which is you may not have any symptoms. You could be at home, but all of a sudden you don't have enough of oxygen, and then people are dying. So things are changing. It is not the same every second.
Yeah, thank you. So any other questions from anyone? Okay, Amal, go ahead.
Let me first thank Dr. Kusum and Nipa for their very educative guidance. And I have two questions for Dr. Nipa. Number one is, you have already answered my question. I had a full denture on the upside, and it was working perfectly all right. But nowadays, I feel that it has become a little loose, because while I am eating, sometimes it has a tendency to fall. So the best way is that polyethylene adhesive or something like that. So I just want to know, I have avoided using it. Is it safe to use that polyethylene adhesive powder a little in the morning and in the night?
Yes, it's perfectly safe. However, as far as your, how old is your denture?
Oh my God, I am very old.
I'm sorry, your denture. How old would it be?
I am 82, and I am very, very grateful to my dentist. Her name is Dr. Vijayalakshmi Acharya. She is based in.
Oh, I know her very well. Yes.
Okay. Now, she gave me the courage to smile, which earlier I could not do that. Okay.
Yeah.
But the problem is now I am okay. And my wife has also got given partial denture last year. Very uncomfortable. I says, you will get used to it. Don't worry. He says, no, it comes off. Is that? I says, the only way is that adhesive, polyethylene adhesive, little, not much. You just do it in the morning, and keep it there. And in the night time, you take it off. Don't go on taking off and on, then you will have trouble.
Right. I would suggest, at least for the full denture, to do something called a lab reline process, where they just take an impression of the inside. Basically, the inside, the part which is attaching to the bone has changed. So they now need a new impression for that, and they add little material there. So there'll be a new base now. So it'll go to the lab for a couple of days or whatever it is, and then when it comes back, it's a little tighter. And then you can, if you need to, you can continue to use Polygrip or whatever. For the partial dentures should not come out that easily. Then there is something incorrect about the design of the partial denture, probably. Because partial dentures are solely take support from the teeth, etc. So if they are coming out, then something else needs to be looked into. The design needs to be changed or something. But if Polygrip is working, then please go for that.
Okay. This is number one. Thank you very much. And I have to get your address, Dr. Nipa, because I am really scared to go to any dentist over here, because the medical cost is so exorbitant, and I am a retired person. I can't afford, just simply can't afford. Full denture, $12,000, $14,000. I said, oh my God, where from I will get it? So I will go to India and get it done. That is what I am doing. And second question is that is it necessary? I put it in that, again, that Polident and that what you call Walgreens, some tablet in the water in the night and overnight soaking. Is it necessary to do it daily, or just 3 to 4 days alternatively?
3 to 4 days is sufficient. Just unless you start noticing stuff collecting in your denture, but 3 to 4 days is usually sufficient.
Because nowadays I can't go out because of this COVID restriction, shelter at home. So I was thinking of economizing, use of tablets.
Yeah, no, daily is absolutely not needed.
Okay, Dr. Nipa, thank you very much. And now you have another question I had, but you have already
Okay.
replied to that. So thank you both, Kushumbe and Nipa. Thank you very much.